NBC News details how Trump's big ugly ass bill will decimate the healthcare industry. So people had hopes, I don't know why, that the Senate would soften the edges.
No.
But NBC reports that proposed cuts to health insurance programs in the budget bill being pushed through Congress by Donald Trump could put hundreds of thousands of healthcare jobs at risk, jeopardizing one of the few notably strong areas of the United States job market. Congressional Republicans are advancing a budget plan that would cause nearly 8 million people on Medicaid to lose their health insurance coverage, according to estimates by the Congressional Budget Office, with an additional 2 million people to lose coverage through the Affordable Care Act if Congress remains on track to let health insurance tax subsidies expire at the end of the year. Less funding for Medicaid and fewer people with health insurance would mean a drop-off in doctor's office visits, prescription refills, and medical procedures, and as a result, fewer workers needed to support those types of services. It could lead to the loss of nearly 500,000 healthcare jobs over the next decade, according to an analysis by George Washington University and the Commonwealth Fund. The expiration of the ACA tax subsidies, which were enacted in 2021, would result in the loss of an additional 140,000 jobs, a separate analysis from George Washington University found. Quote, hospitals will close, health centers will close, pharmacies in some parts of the country will close because they will lose revenue. There are going to be job losses, and we're talking about middle-class jobs being lost.
Right. So that the part that struck me about that is in the rural communities. So who is mostly residing in the rural communities?
They people. Yeah.
His supporters. So this is how you reward the people that supported you. You reward them by taking health care from them and having vital services lost in their communities.
And people
are going to die.
Yeah, I was about to say that. People will die because they're going to have to, like, if you have a hospital in your small town and it closes because it goes bankrupt, then you might have to travel 30 minutes, 60 minutes. So you have a heart attack and you got to go 60 minutes to get emergency care,
and you won't make it.
And it can't be overstated that, again, the people who supported Donald Trump are the ones who are going to be mostly affected by this in rural areas. And I just think that Democrats need to shout that from every platform
and they
that
want
they
to be
can.
too proud to say, well, we don't want to say, I told you so.
Say it.
Every day.
Say it.
Yeah, I think at this point the gloves need to come off and people need to be speaking to each other in plain terms and in terms that drive the point home that we can't play around anymore. It is that serious.
Yep.
We need to be in Wyoming. We need to be in Montana. We need to be in Utah, Idaho. We need to be in North Dakota, South Dakota, Nebraska, Kansas, Oklahoma. Not just in Houston, Texas. We need to be in Dallas, Fort Worth. We need to be in the surrounding areas of that. We need to be in Midland and Odessa. Talking our shit. That's what we need to be doing. We need to be in Mike Johnson's district. Telling the people.
Well, guess who went to Mike Johnson's district?
Who?
AOC and Bernie.
See?
Well, yeah.
They know what the fuck they doing.
Right. That's good.
That was this past weekend.
Because they're the ones that's going to be affected. In Mike Johnson's district.
What Trump said.
What?
He said, they don't know what the fuck they're doing. I said, they know what the fuck they doing.
But in that part of Louisiana, that is the rural part of Louisiana. That's where his support is. It's not in the urban centers.
It's not New Orleans, Iran. It's not New Orleans. We didn't do shit. New Orleans ain't did shit. We voted 80% for Kamala.
Okay, so the article goes on to say the health insurance provisions are part of a broader spending bill that has passed the House and is currently making its way through the Senate. The legislation, which Republicans have dubbed the Big Beautiful Bill Act, would cut around $800 billion with a B, dollars from Medicaid, the health insurance program for poor and disabled, in order to help offset some of the $4 trillion in tax cuts extensions in the bill for individuals and corporations. A version of the bill currently in the Senate, which plans to start voting on the legislation next week, would go even further in reducing spending on Medicaid by including a provision to limit states' use of taxes on hospitals and other healthcare providers that help states fund their share of the Medicaid program. Absent any policy changes from Congress, the healthcare sector had appeared to be on track for continued growth and largely isolated from wider concerns about tariffs and economic slowdowns. The number of job postings for doctors and surgeons on Indeed.com are about 90% higher than their pre-pandemic levels, and listings for home health aides are up 46%, and openings for nurses up 16%.
So I don't have words. I'm getting angry as I'm sitting here because when I think about what's going to happen to people who are disabled, people who have chronic illness that depend on those services, like we said before, people are going to die. And I think sometimes we become sort of numb to these factors as this stuff is happening because you hear about it over and over again, but we can't allow ourselves to become numb. People are really going to suffer.
And then some people are like,
And
well,
like,
it doesn't
why?
affect me, so I'm not going to worry about it.
That part that you read before about them limiting what the states can do to fund Medicaid, it's like that's real into the weeds and nitty gritty.
Well, that's petty.
And sinister, right?
And what about states' rights?
Yeah, states' rights.
Oh, okay.
It's states' rights when y'all want to tell women they can't have abortions, but when it comes to actually giving people what they need, your very supporters what they need, it's, oh, well, I'm taking it away.
And also, this is why I say they're not pro-life.
No, they're
They're
pro-birth.
pro-birth. Because after the child is born, you could give a damn.
Yep.
Big stanky booty ass bill.
All
Are we
right,
great
y'all.
yet?
Huh?
Are we great yet?